Channel 3 is your vaccine authority, and of course we've been getting so many of your questions for weeks now, all about the vaccine and the virus itself. So each day we are helping to get you some answers. And joining us this afternoon is Michael Urban from the University of New Haven School of Health Sciences. Michael, thank you very much for being here with us again today.
Thank you. Thank you for having me.
I want to get right to our first question here. Marianne from Waterbury is saying, I have been hearing so much information explaining that vaccine side effects mean your immune system is working. Now I'm concerned that if I didn't get side effects with either Pfizer dose, that maybe the vaccine won't work for me.
A lot of people have said that. Some people have not had a reaction or a side effect of what people think about, but actually the vaccine is working. You actually often don't want to have a side effect. Some people might get a small fever, chills, or body aches or soreness where the injection was. Some other people get very sick. But if you don't have any reaction at all, that just means your body, it still is working. Your body's not having, just a reaction to the virus itself or the substances that was used to make that vaccine. So don't be worried. It still is working.
Well, that's good news. We seem to be hearing from people, though, who have responses after the second dose. Do you hear that as well?
Yeah, typically, especially I heard with Moderna, specifically that dose, a lot of people in the second dose have had more of a reaction, not a side effect, but more of a reaction to it. Again, just as how your body reacts to the vaccine process.
Okay. Now, Diane from Plainfield is asking, a lot of people have been taking immune system support supplements during the pandemic. Should these be stopped before getting the vaccine?
Again, there has been nothing to show that they are going to do anything for or against the vaccine, from what I've seen with literature and the science coming out. If you have any questions regarding immune supports or any medication, always talk to your doctor first. But again, at this time, if you've been taking it, it's not going to do anything to hinder the vaccine effect, how effective it is. So again, I would not discourage you to stop it. But again, if you have any questions, we're really talk to your primary care doctor with any medications at that point.
Yeah, for sure. Now, our last question right here is coming from April in North Windham. Has there been any study to show which vaccine out of the three lasts the longest against COVID?
Right now, they're still looking at those numbers. The data keeps changing and shifting a little bit. So it's a new virus, so it's a new vaccine, so we don't really know over the long haul. But there is questions around a year. Some may go a little bit longer or less, but they're all relatively around the same time frame. They are questioning right now. They are doing some studies to see if after 9 months, 12 months, if we'll need a booster shot or not. And that will be coming forth as they monitor those first initial participants in the clinical trials to see how effective, and they monitor those people over the long haul.
Well, I'm sure we'll learn a lot.
Now there is no clear answer.
Yeah, I'm sure we'll be learning a lot, though, over the next few months, and as they talk more about what will happen down the road with other shots as well.
Yes.
Okay.
Yep.
Michael Urban, thank you very much for joining us again today from the University of New Haven. We appreciate it.
Sure. Thank you.